I'm going to stick with winter flu because it is a sort of regular occurrence and we can plan as well as we can for anything. Yep. So I have some specifics that I'd like you to speak to, if that's okay. So the first one is around schools and the programme that is rolled out across all schools to try and reduce flu transmission, so really getting ahead of the flu before it gets going. And I appreciate this year the flu season did start earlier. However, could you please explain to me why the starting date for schools to begin this programme varies so widely? And for example, in my constituency, there were schools that were literally just getting going with their programme a couple of weeks before Christmas. So from a national strategic point of view, what is being done to make sure that as soon as those schools hit their September start date, to the best of our abilities, that programme is being rolled out? Who would like to speak to that?
I'll pick that one up. I think as well as the start date, let's kind of pick up on the end date as well, because I think that's also important. So I think it's a great question. So along with JCVI, on the back of JCVI recommendations, we can start the children's flu programme as well as kind of vaccinating those who are pregnant from the 1st of September, obviously with others following from October. So we are good to go.
Why is it not happening as standard across the schools? What's the problem?
So there's probably two things that I'd call out on that one. So from the 1st of September, obviously the green light and the get-go is dependent on when vaccine lands in the system, and I think you've heard from colleagues about kind of the manufacturing process. So we normally expect that from the second week of September. So literally from a national point of view, the systems should be ready to start vaccinating in schools from the 1st of September as soon as vaccine lands.
Why do you think they're not? I mean, I understand the idea around it. Why is it not happening?
No, I do. Exactly. So I think there's a lot of work to do in this space. I recognise there is variability across the country. There's variability in terms of capacity within providers, some of the systems that they use. There's challenges. There has been historically challenges around consenting in particular. But
which we were talking about earlier around accessibility of vaccines, how difficult. I think my colleague Greg Fell said, if the letter's in the school bag or whatever, you've got a million things to do with your kids, so that does need to be thought about.
It does need to be thought about, and again, on the back of the strategy, what we have developed, co-designed with system users, with parents and with practitioners, is an in-house system that is about managing vaccination services in schools. So again, going back to the point of care. And Annie's actually using this in Leicestershire, so probably give you a better kind of real-life example. But in effect, what that does is probably three things. One, it makes it really super easy for parents to consent via their phone. You can actually get a message that is readable, so you don't have to zoom in and zoom out. You can consent for your child to take up the offer of vaccination via your phone. That then also lends itself to efficiencies, but also safety, thinking about the administrators who support those services being able to automatically cross-check consent with the class, set up the clinic, etc.
Right. Michelle, in the interest of time, if you could write the plan, that would be great. I suppose what I'm saying is it's February now.
Yes.
We've got a few months to go until September 1st.
Yes.
How assured am I, as the MP for my constituency in Worthing West, all my colleagues, all 600 and odd MPs, that their schools are going to have a good functioning flu prevention programme for students from the 1st of September or the second week or whenever the vaccine lands. When we speak again next year and we go, oh, fantastic, all schools, started second week of September, finished end of November, how assured are we that that's going to be the case?
Well, we are, as you said yourself, we're still in the flu season. We are working through what should that look like, what must that look like, what does that need to look like going into next year.
Let me be more salient. Are we assured that for the next flu season, which let's face it is not far away,
well, we're working on it now.
It's going to be in place. So were you going to be able to come back next year and tell me that it worked so much better and it'll be finished by the end of November?
What's going to be different?
Well, what's going to be... I think we are working really hard to make sure we are building improvement and huge improvement into those programmes.
Right, okay, so let's see if that actually comes forward. Lovely. So,
Could I
go on.
It would be just helpful, I think, to give an ICB perspective. So I think the role of ICBs is going to increase in this space over the next year. So I think we will be playing a more active role in working with our local providers. So we will be round the table with the school age immunisation service planning that intervention. One of the issues around the start date, ours started on the 15th of September, so in pretty good time, although we would have liked it to have been the first, and it was to do with vaccine supply. But sometimes there is coordination needed with the schools. There are sometimes operational planning difficulties, but they are the sorts of things that we as a health system can overcome, working with our local authority colleagues, that is much harder for a remote commissioning team as NHS England.
And then that's great to hear, Annie, and I think my concern there is about variability across the country, because I'm sure Leicester and Rutland is absolutely charging along in many things, but there is variability. So I think even though at your sort of particular ICB, that's great to hear, I think from a national point of view, what I want to hear, and my colleagues just said, are we going to see a target of 85% coverage, whereby 85% of schools are going to finish by the end of November? Are you going to set yourself a target to see that is an actual thing nationally?
I think what we are looking at doing is making sure that we are pulling forward the end date, so actually that we do have time before the Christmas break to go in and do second visits or to catch up for those kids who may not have been at school the first go round.
Brilliant. Well, definitely
you don't have a target. Forgive me. You don't have a target.
That's right. Don't worry.
I'm sorry to pick up on that, but I just do want to press on this because it came up earlier as well. And forgive me, Becky. I have no mind.
Go.
You don't have a target for how many schools, percentage of schools where this should be effective by this time next year.
No, we do. So every year we expect every school to have had a visit.
Your target's 100%?
Yes.
Right.
But we're pulling it forward, so we've got even more time to do second visits or catch-up clinics in communities to make sure every kid gets the opportunity.
By the time we get to next winter, we expect the digital system that Michelle was describing to have been rolled out across a lot more providers and to be in a lot more schools.
We expect miracles, David, and we expect fabulous things, and we'll look forward to hearing all about it. We're going to move on to frontline healthcare staff, because also an incredibly important target group. And having been a frontline healthcare staff person myself, I am absolutely astounded this vaccination uptake remains so low. So on average, it remains below 50%. It remains, I think, about 41%, and there is variation across the country. So if I look at the sort of data in front of me, I can see that vaccination rates are fewer than 1 in 5 at 21 English NHS trusts, and at West London Trust, Croydon Health Services Trust and Birmingham Solihull Mental Health Foundation Trust, uptake was at 1 in 10 or fewer. So this seems to be an absolutely urgent place where we should be putting resources and all our brain power. What is happening and how are we going to get these rates up?
Good question. So, couple of things. So, can we talk about this year and then we'll talk about the future? Is that okay?
Please do.
Perfect. Okay. So, again, in the context of continuing decline, we need to stabilise that and build out of that.
Why is it declining, Michelle? Why? What is going on?
So I think there's a couple of things going on. So on the back, we're still hearing noises around reaction to vaccination as a condition of deployment that was brought in the pandemic, where that was mandated through COVID vaccine, and that did not. I think we're all well rehearsed in the kind of impact that had, both in terms of how staff felt about it, but the trust that staff had as well at the same time. So I think that is definitely continuing to play an impact, to play a role. I think then, just thinking about what's happened this year, so we're now kind of knocking on the door of 48% uptake, but I agree with you, that is not where we want to be. So let's kind of...
and the variation for those trusts less than 1 in 10, that's absolutely outrageous.
Absolutely. Yeah. So again, I think we need to build on what's worked this year. So first things first, every trust, they were required to have executive leadership who were accountable, responsible to ensure that there was maximum uptake across their NHS trusts in terms of staff vaccine.
And so they've got targets to hit?
So it was.
It has. So what happens if they don't hit those targets?
So there's a couple of things. They have lots of lean-in conversations to understand actually what is happening here.
It doesn't sound particularly serious, a lean-in conversation. Anything else?
So a couple of things. So on the published data, what's really important to know on some of this stuff is actually there might be challenges in terms of how that data is collected. It might be inaccurate, etc., etc. So it is about having a conversation in partnership to understand what is going on in this space.
I take that there's always variation in data, but across the entire country, we're getting a fairly standard picture. That variability is much reduced because of the large sort of, collection here. So I think we can say that within a sort of, whatever confidence interval, we're reasonably clear that this is still not an acceptable amount. So
absolutely,
we're having leaning conversations with people. We're going to have executive leadership. There's going to be a target that they're going to have to hit.
There is a target.
And our people, I don't know, Annie, if you want to come in, What's going to make a difference? Why are my healthcare colleagues not getting immunised? What is going on?
I think with all of these challenges that you are making around why aren't levels increasing, I think we need to recognise that time is needed. Now, I know that's urgent, but we need to reap the benefits of the changes that are being introduced now.
Just a gentle challenge there. I absolutely hear you around time. I'm a public health consultant. Things take time. However, during the pandemic, things did not take time. We simply went out and did it. I would argue this is a similar issue where we should just go out and do it. So what are the blockers?
So I think there's a practical reality for frontline workers are busy and they're under a huge amount of pressure doing their day job. So the reason we've seen a 9 percentage point increase in our uptake in our 2 trusts this year is because they changed the delivery model.
Ability again is a problem.
COVID drove the trust to a model of clinics, and the staff had to go to the clinics to get vaccinated. COVID's no longer offered. Those clinics don't exist anymore within the hospital setting. So they've created roving teams again, so returning to the peer vaccinator model. So there's around 180 peer vaccinators in our acute trust now that have taken the vaccine onto the wards, and we believe that that's probably fundamentally the biggest impact. There have been some other kind of soft incentives given to staff, like, you know, have a hot chocolate and get your vaccine.
I understand all of that. Do you think that we are, and this is a question, do you think this is being prioritised sufficiently within our National Health Service? So when the ICB sit there, when the chief execs of trusts sit there and talk about getting waiting lists down and pressures and bed blockers, etc., is this a fundamental part of their prioritisation? And I appreciate it's subjective because you're talking for various people, but what do you think?
I think 2 things on this one. I think having it as part of the joint planning for winter, in terms of joining it up with where people's heads are at in terms of ambulance handovers, 4 hours delays, has been really powerful this year. And I think actually that's, so considering in the round of winter pressures, yes. I think then the second thing is having a named executive lead, both within the trust but also within the ICB, and I think that was something that came out of your report. So those people have been in place for 2 years now. I think having this conversation, focused conversation about vaccination, we're talking specifically about staff here, but I think in the round is incredibly important to have it at that top table.
Okay,
so
I'm going to have to leave it. I could talk to you for hours, but thank you so much, Joan.